Imagine this. You're going about your day, feeling fine, but deep down, your body is trying to tell you something serious. What if I told you that many of the symptoms of heart disease can slip under the radar, showing up in ways you'd never expect? And that by the time you're feeling something major like chest pain, it could already be too late. The truth is, heart disease doesn't always show up with the typical elephant on your chest warning sign. In fact, some of the most critical symptoms can be so subtle that you might ignore them until it's too late. Heart disease is one of the leading killers worldwide, but here's the shocking part. Most people have no idea that their heart is in trouble until they're hit with a full-blown crisis. Whether it's something as common as feeling tired all the time, unexplained pain in your jaw or neck, or even difficulty in the bedroom, these seemingly harmless symptoms could be your body's way of signaling a growing issue with your cardiovascular health. And here's the kicker. You may not even feel any chest pain at all. As a doctor with years of experience, I've seen firsthand how these overlooked signs can be the difference between catching heart disease early and facing a serious, life-threatening condition. In this video, I'm going to show you the hidden signs of heart disease that often go unnoticed. I'll walk you through symptoms you'd never think could be connected to your heart, and by the end, you'll be better equipped to recognize these signs in your own life. This isn't just about information, it's about saving lives, including your own. Stay tuned, because what you're about to learn could change the way you look at your health, and even save it. Jaw, neck, and shoulder pain, a subtle indicator. When you think about heart disease, you probably picture chest pain, right? The famous elephant on the chest feeling. But here's the shocking reality. Heart disease can strike in ways you'd never expect, and sometimes, chest pain is nowhere to be found. Instead, the early signs might show up as pain or discomfort in places like your jaw, neck, or left shoulder and arm. Sounds strange, doesn't it? But let me explain why this happens. As the arteries in your heart narrow or become blocked, blood flow to the heart is restricted. The body's response to this blockage doesn't always center on your chest. It can show up in areas that are connected to the heart, like your jaw or shoulder. Think of it like this. When your heart struggles to get the blood it needs, it causes a chain reaction in the body, and that's when the pain starts manifesting in places you wouldn't expect. The problem? Most people write off this kind of pain as something minor, like a toothache, stress, or just getting older. Let me tell you about a patient I saw in my practice a few years ago. A man in his early 60s came to me complaining of persistent jaw pain. At first, he assumed it was a dental problem or that he was just under stress. But given his age and other risk factors, I wasn't ready to dismiss it. After running a few tests, we were stunned to discover that he had significant blockages in his coronary arteries. What seemed like a routine dental issue turned out to be a major red flag for heart disease. This story is a perfect reminder that sometimes, your body's way of telling you there's a problem isn't obvious. So if you experience unexplained jaw, neck, or shoulder pain, don't just brush it off. It might be your heart giving you a warning. Chest heaviness or tightness during exertion. Another classic symptom of heart disease that gets overlooked is chest heaviness or tightness during physical activity. You might think that chest pain only happens during moments of extreme exertion or stress. But let me tell you, it's not always like that. I've had countless patients tell me they feel a sensation of tightness or heaviness in their chest when they walk briskly, climb a flight of stairs, or do something as simple as carrying groceries. These symptoms are often dismissed as nothing serious, especially when they go away after a short break. But here's the thing. Even if the discomfort fades, it doesn't mean the problem has gone away. I had a personal experience with this. My father, who's always been an avid runner, started noticing a strange heaviness in his chest after running, particularly when going uphill. It wasn't pain, just a new sensation that was unlike anything he had felt before. At first, he thought it was simply due to getting older, but he knew something wasn't quite right. After further tests, we discovered that one of his coronary arteries was narrowing. He needed a stent, and after the procedure, he was able to continue running without any issues. This experience drove home the lesson that symptoms like chest tightness, however minor they may seem, can be the first signs of a serious heart problem. It's a warning, and you shouldn't ignore it. Fatigue, the silent warning sign. Fatigue. It's something we all feel at times, whether it's from a long day at work, a lack of sleep, or stress. But what if I told you that constant fatigue could actually be a sign of something more serious? Many people dismiss chronic tiredness as a natural part of life or aging, but when your heart is struggling to pump blood effectively, the consequences go far beyond feeling a bit worn out. When the heart isn't working at full capacity, it affects your body in multiple ways. It decreases the amount of oxygen-rich blood that flows to your muscles, lungs, and other vital organs. This results in extreme tiredness and makes even simple tasks like walking, climbing stairs, or carrying groceries feel like monumental challenges. Imagine what it would be like to feel exhausted after activities you used to do without even thinking. That's the danger of fatigue. It can often be a subtle but critical warning that something is wrong with your heart. If you notice that you're more tired than usual, especially after activities you've done 1,000 times before, don't ignore it. Fatigue could be a red flag, signaling an underlying heart issue. Shortness of breath and sleep apnea. Now, let's talk about shortness of breath. If you find yourself getting winded after doing activities that you used to breeze through, that's a big red flag. But here's something many people don't realize. Sleep apnea is a risk factor for heart disease. Sleep apnea, which causes breathing interruptions during sleep, doesn't directly cause heart disease, but it can put a lot of strain on your heart over time. During episodes of sleep apnea, your oxygen levels drop, forcing your heart to work harder to pump blood and keep oxygen circulating through your body. Over time, this puts you at greater risk of developing high blood pressure, atrial fibrillation, and even heart failure. I've had patients with sleep apnea who didn't show any classic heart disease symptoms, yet they eventually developed serious cardiovascular conditions. If you snore loudly or find yourself waking up gasping for air, it's important to talk to your doctor about how sleep apnea could be affecting your heart. It's often overlooked, but it's a real risk to your cardiovascular health, and it's something you shouldn't ignore. Erectile dysfunction, a clue to arterial damage. Let's dive into something that's often avoided in conversation: erectile dysfunction, ED. While it might feel awkward to talk about, ED is actually one of the earliest signs of arterial damage. You might not connect bedroom problems with heart health, but the blood vessels in the penis are actually smaller than those in the heart. This means that if there's narrowing or damage in your arteries, it often shows up first in this area. I always tell my male patients that if they experience ED, it's essential to seek a cardiovascular evaluation. The underlying cause of ED is often arterial damage that impacts blood flow, and if it's affecting the arteries in the pelvic region, it's highly likely that other parts of the body, including the coronary arteries, are also affected. Don't ignore ED. It could be a signal that your heart needs attention, and it's crucial to take steps to address the problem before it gets worse. Peripheral vascular disease, PVD leg cramps, as a warning. Peripheral vascular disease, PVD, is another condition that often flies under the radar, but it's one you can't afford to ignore. PVD affects the blood vessels in your legs, causing narrowing or blockages that lead to cramping, tightness, or discomfort during physical activity. The feeling is very similar to the tightness or heaviness you may experience in your chest when dealing with heart disease, but it occurs in your legs. If you experience leg cramps that go away after stopping physical activity, it's time to take a closer look at your vascular health. This could be a sign that the arteries in your legs are narrowing, and if it's happening there, there's a good chance that other arteries in your body, especially the ones feeding your heart, could also be affected. It's essential not to dismiss these symptoms, because they could point to much more serious vascular problems that affect your heart as well. Don't wait for the symptoms to worsen. Get evaluated before it's too late. Symptoms of carotid artery disease. Finally, let's talk about carotid artery disease. This condition is one of the most overlooked risks for stroke, and it can also be a warning sign of heart disease. One of the early symptoms of carotid artery disease is something called transient monocular blindness. This occurs when you suddenly experience the sensation of a shade coming down over one eye. It's not just an eye problem. It's actually a sign that a plaque has broken off from the carotid arteries and is temporarily blocking blood flow to the eye. If you experience this shade sensation, don't write it off as eye strain or fatigue. It's a serious symptom that could indicate that a blockage in the carotid arteries is putting you at risk for a stroke or other cardiovascular events. Seek medical attention immediately. It's better to be safe than sorry when it comes to your brain and heart health. Heart disease is often referred to as a silent killer because it doesn't always announce itself with the dramatic signs we expect. Instead, it can creep up quietly, manifesting in subtle ways that are easily dismissed or overlooked. As we've discussed, symptoms like jaw pain, fatigue, shortness of breath, or even erectile dysfunction can all be red flags. These aren't just isolated issues. They are signs that your heart may need attention. And when it comes to heart health, ignoring these symptoms can be a dangerous mistake. The key takeaway here is clear. Early detection and intervention can make all the difference. You don't need to wait until a heart attack or a major event occurs. If you experience any of the symptoms we've talked about, whether it's that nagging jaw pain, unexplained fatigue, feeling out of breath, or issues that seem to arise in the bedroom, don't brush them off as minor. These symptoms could be your body's way of signaling that something more serious is brewing beneath the surface. Taking control of your health is the most powerful thing you can do right now. If any of these signs sound familiar to you, don't hesitate to take action. Talk to your doctor. Ask for the tests you need to ensure that your heart is in good shape. There's no shame in being proactive about your health. It's one of the best ways to protect yourself and your loved ones from future complications. And the truth is, the sooner you take action, the better your chances of preventing heart disease from escalating. Remember, heart health is too important to ignore. It's not just about avoiding a heart attack or stroke. It's about ensuring that you can live a long, healthy life with energy, vitality, and peace of mind. Don't wait for the symptoms to worsen. Take that first step today. If you're experiencing any of the symptoms we've discussed, I urge you to take action now. Don't wait for tomorrow, because tomorrow may be too late. Reach out to your doctor, request a comprehensive heart checkup, and take the necessary steps to protect yourself. Your heart deserves the best care, and you deserve to live a life free of worry about your cardiovascular health. Take charge of your future today, because your heart is worth it. Stay proactive, stay healthy, and remember, your well-being is in your hands. Don't wait. Take action now.